I am Dr. Suroshree Mitra, Professor and HOD of Community Physiotherapy Department and HSCT Committee Chairperson in the college. And today I'm going to take a small PhysioTV classroom session on Bloom's taxonomy. So as teachers, as facilitators, it is a very important topic. And as a part of basic health science education technology, all of us, all the teachers need to understand what is this Bloom's taxonomy. Because as teachers, we start teaching from first year till final year and even in internship. And there are institutes where we have master's program. So in this taxonomy, which was given by Bloom's, there are three subdivisions. The domains are cognitive domain, psychomotor domain, and affective domain, as you can see on your screen. So what is this cognitive domain? So when we teach our teachers or train our teachers regarding the Bloom's taxonomy, this is what we call it as the domain of head. Why is this domain so important? We should understand that whenever we start teaching and when we expect learning from our students, knowledge is always the primary base. It is the primary foundation. So that's why the domain of heart or the cognitive domain has a very important place. So here, as you can see, that there are 6 subdomains or 6 levels under the cognitive domain. So going from down to up, as we can see on the screen, under the cognitive domain, we have first level 1 as knowledge, level 2 as comprehension, level 3 as application, level 4 as analysis, and level 5 synthesis, and lastly level 6 is evaluation. So what are these 6 levels is first what we'll try and understand under the cognitive domain. So as you can see that when we start teaching and when the students start learning, the first thing is basically just the knowledge. It could be basic definitions, basic categorization, enumerate, and it's all at the recall level that what they are supposed to just learn and recall and explain and produce whenever time comes in the form of theory examination or practical examination. So that is why level 1 is the basis of just the knowledge and basis of cognitive domain. Gradually, when they reach the level 2 of the cognitive domain is when the students start comprehending. They start correlating certain things with each other, like physiology with pathology, pharmacology, physiology, anatomy with pharmacology, and so on. So gradually, when they move from systems to how these systems interact with each other in the human body, all that goes into the level of comprehension. So in the level of knowledge, they just have the knowledge, the idea about the what is what. And then in the second level, what they understand is the comprehension. That is how to correlate or basically join the dots of different knowledge. Then comes the third level, which is level of application. Here, they don't just comprehend, but also try and analyze that how in the real life scenarios, they will start applying this. So it's very important that not just about for example, in electrotherapy, it's not just important that why or what is different modalities, that is TENS, IFT, SWD. In comprehension, they understand how the structures are made up of and how the different electronic devices in combination work together. And finally, in application, they realize or they try to understand the role of each modality for different types of pain in the body or symptoms in the body. So this is how in the level 3 of cognitive domain, they start understanding the application. But not to forget, this is still under cognitive domain. So there is always a component of knowledge and learning under this cognitive domain, where the students have to read books and sometimes also articles and other reference books. Now comes the level 4 of cognitive domain, which is the level of analysis. In this level of analysis, they try to understand that how they will differentiate that um, which medicine or which exercise to be given in which condition. What are the contraindications? When a modality should not be given, when a modality should be given. So all these contraindication, elimination and indications understanding comes at the level 4 analysis level under cognitive domain. So as we can see that level 1 is always the base. You have to have level 1 to reach level 2. You have to have level 2, that is comprehension, to reach level 3, that is application. You have to have level 3 application to reach level 4 analysis. Finally, we come to level 5 and 6, which is synthesis and evaluation. Here, the students are actually able to apply on the real patients, and they are able to do it with a good clinical reasoning. So when a student reaches this level, he or she is able to give a good clinical reasoning and is able to apply holistically whatever knowledge the student has about a certain pathology, about a certain diagnosis, and with clinical rationalization, he or she is able to deliver the sound management to the patient. So with this, we are done with the first category or domain under Bloom's taxonomy, that is domain of head and also known as the cognitive domain. Now we move on to the domain of heart, the domain of hand, which is the psychomotor domain. And something which is very, very interesting about it is that as physiotherapists, the domain of hand is the most important domain because physiotherapy has to do more with the skills. So that is why the psychomotor domain is of utmost importance right from first year to final year internship and even in master's program, because under these domain is what a physiotherapist learns how to use his physiotherapeutic skills on models followed by patients. So here, as we can see that under the psychomotor domain, there are 3 levels. Level 1 is imitation, level 2 is automation, and level 3 is control. In level 1, what we understand is the student learns to imitate the facilitator or basically imitate what he or she is told to or instructed to or demonstrated to do. So in the level 1 of psychomotor domain, they are in a position to perform the skills in the form of checklists or in the form of a systematic procedure. When they reach the level 2 of psychomotor domain, that is automation, they start performing or repeating the same skills in a controlled and structured manner in a correct way on the models or sometimes eventually on the patients. And in the final level, that is level 3 of the psychomotor domain, that is a control level, they're able to make justifications, they are able to do clinical rationalization and perform the same skills in a different way in different patients. For example, they are able to rationalize and perform Maitland grade 1 and 2 for certain conditions and 3 and 4 for certain conditions. So that's how when they reach the level of level 3 control of psychomotor domain, they are able to clinically rationalize and are able to perform justifying why they are doing, and the skills are also become controlled in a manner that they are not really just performing it, but they know why, and they also have highest skill with a lot of practice of how to perform that skill effectively on the patient for patient management. So with this, we are done with the domain of hand, that is the second domain of Bloom's taxonomy, also known as psychomotor domain. Now, coming to the third domain of the Bloom's taxonomy, that is the affective domain, or also known as the domain of heart. As we know that heart is always associated with emotions, with empathy, with reactions, with affection. So this is a domain which is very vital for healthcare professionals. Under the affective domain, again, as we can see, there are 5 levels. In level 1, there is receiving. Level 2, there is responding. Level 3, valuing. Level 4, organization. And finally, leading to value complex. So here, what the student needs to learn is initially how they should be receiving, responding, and understanding values, cultures, empathy, sensitivity towards patient's pain, patients' caregivers' pain, patients' caregivers' reaction, how they should educate their patients' relatives, how they should communicate with their patients' relatives, other healthcare professionals. And finally, when they reach the level of organization and value complex, they're able to inculcate and apply all the other factors related to the affective domain in terms of communication, patient education, effective patient education, counseling, and also they're able to completely empathize with their patients while they are listening to them in the form of history taking, while they are doing the assessment, and also while they are giving patients treatment and emphasizing on the role of exercise in the lifestyle. So, with this, we come to the end of this session on Bloom's taxonomy. Just to revise, there are three primary domains which Bloom had introduced, which is the base of teaching learning method by a teacher to a student. The first domain is the domain of head, which is the cognitive domain, and there are 6 sub-levels. That is knowledge, comprehension, application, analysis, synthesis, and evaluation. The second domain is the domain of hands, that is psychomotor domain. The 3 sublevels are imitation, automation, and control. And the third subdomain is the affective domain, that is the domain of heart, which has 5 levels: receiving, responding, valuing, organization, and value complex. So with this, we hope that after seeing this session, the teachers and the students understand that these 3 domains are of utmost importance, and whenever we are imparting education to our students, we have to always categorize our teaching learning and teaching learning methods based on whether falls under cognitive domain, whether it falls under psychomotor domain, or whether it falls under affective domain. Thank you very much.